This is Beheshta Paiman, a fellow and article reviewer of IDDB Journal. And this month in IDDB Journal, our featured article comes from University of Lübeck, Department of Surgery from Germany. I'm really happy to have Petra Duhm-Harbeck, one of the authors of this interesting article called Data Protection in Healthcare-Integrated Biobanking. Welcome, Petra, and thank you so much for accepting our invitation and talking about your valuable knowledge and experience in this subject.
Thank you, Beheshta. Thank you for the inviting, and I'm very glad to be here.
Same here. So could you start off by talking about essential points on the generic data protection concept and its potential impact on personalized medicine?
Yes. Let me first start with personalized medicine. The development of personalized medicine depends on research using clinical biospecimens and data. This interface between clinical care and translational research is increasingly served by hospital-integrated biobanks, yet their implementation is hampered by complex data regulations. The development and implementation of the necessary data protection concept poses a particular challenge. It should not affect patient care, but be feasible and enabling for translational research while meeting national requirements regarding data protection, data security, ethical social concerns, and the European General Data Protection Regulation. Fulfilling these criteria, biobanks can enable, for example, molecular tumor boards with evidence-based support for individualized therapy decisions. Answering the outlined requirements, a generic data protection concept for biobanks in a clinical context was created, and a decision and application matrix for classifying the biobank according to the local conditions was developed. This generic data protection concept addresses 5 criteria. The first, organizational integration of the biobank into the university medicine. Second, the biobank governance. Third, ethical legal aspects. Fourth, structural, legal, and technical aspects. And fifth, the IT architecture and process flows.
Okay, impeccable. I guess it's great. According to your article, you identified the necessary criteria and you developed a decision and application matrix based on local conditions. So maybe you can take us through this very important approach and describe the generic data protection concept for the biobanks, of course, in clinical context.
Yes, gladly. For our implementation test, we selected Germany because of its particularly diverse and strict set of regulations, which are based on European law, namely the European General Data Protection Regulation, but are also subject to different legislations in Germany's 16 federal states. So let me please show you through this implementation along the generic data protection concept and explain the decision and application matrix. Organizational integration of the biobank into university medicine is the first criterion. As the complexity of the implementation depends on the campus model of the university and the IT competence areas, the decision and application matrix came into use to classify the biobank according to the conditions of its location. The University of Lübeck and the University Hospital work in a cooperation model. The Lübeck Biobank, the Interdisciplinary Center for Biobanking Lübeck, belongs to the university, but works as a hospital-integrated biobank in a clinical context and uses, therefore, the external outsourced IT department of the university hospital. Based on these determined allocations, the necessary contractual regulation can be read off at the bottom of the matrix. Necessary is a commissioned data processing contract between the university hospital and the external IT department. Then, the cooperation contract between university and the university hospital is needed, and also a cooperation contract between university and the external IT of the university hospital. The second criterion is the biobank governance. As a central institution of the University of Lübeck, the ICBL is a hospital-integrated biobank, as said, in cooperation with the University of Lübeck and the University Hospital of Schleswig-Holstein. The procedural responsibility belongs to the Presidium of the University of Lübeck, whose tasks are handled by the Presidium representative of the ICBL. Third, ethical legal aspects. This chapter explains how the legal and ethical requirements are met. In particular, the consent concept of Lübeck is described here.
Okay.
Fourth are the legal and technical aspects. In Lübeck, the access protection regarding the properties and safeguarding the system related to any force majeure are part of and regulated in the cooperation contract between university and outsourced IT department of the university hospital. The software-related authentication, as well as the rights and roles concept, are described in this chapter. All this is based on the specifications of the German Federal Office of Information Security, the BSI. The fifth criterion is the IT architecture and process flows. This chapter deals with the process flows, including the pseudonymization process and the interfaces, all based on the FAIR principles. Data have to be findable, acceptable, accessible, interoperable, and reusable. The data protection concept was proved by the local data protection officers and ethics committees, and nationally by the Technology and Methodology Platform of Medical Research in Germany. The concept allows automated research-guided patient recruitment and data protection compliant IT connections to national, for example, GBA and GBN, and international research networks as BBMI ERIC, for example. It ensures university and hospital conformity with the European General Data Protection Regulation. Consent behavior of more than 270,000 patients over 5 years proved routine practicability. Clinical or scientific staff obtain higher consent rates compared to consent rates for use of data only in central patient admission, even though consents in central patient admission increased constantly during observation time. Thus, the generic data protection concept can legitimately enable personalized medicine through biobanking in the clinical context.
It was an amazing concept, honestly. Besides, the criteria that you mentioned are clear enough to help the biobankers, health workers, to make into account for their own biobank. Also, an essential issue in your paper is genomic data protection. So, what's your overall idea about this? Is genomic data set to become more prevalent in the years to come as a part of routine clinical practice? What are your thoughts? How would this affect infrastructure such as biobanks? What do you think?
In the coming years, genomic data will increasingly become a substantial part of clinical routine, since genetic factors, lifestyle, and environmental influences have an impact on diagnosis and therapy decisions and response. Consent behavior will become even more relevant. For example, is the consent of the patient's siblings and/or parents necessary? Have those any way to be informed about the research findings? What about rare diseases? Due to the extensive use of genetic diagnostics in this field, research on rare diseases is difficult to handle in terms of data protection. But even here, voluntary consent is an ethically and legally solid base for research in this context.
Thank you so much, Petra, for this remarkable work and contribution. We're waiting for your new papers and research from your side in the future.
Thank you very much, Beheshta. It was a pleasure.
Thanks to you.